Medical respite is an entity unique to homeless medicine. It is a place where someone experiencing homelessness who is too sick to be on the street or in a shelter, but not sick enough to be in the hospital, can go to get the appropriate level of medical care. Medical respite operates most effectively when there's great partnerships. So Unity Healthcare is the only, as far as I know, medical respite provider from the medical side of things, but we partner with shelters, we partner with insurance agencies, and we partner with the city in the development of a new medical respite facility at a large men's shelter. We actually have beds for both men and women, even though the shelter is largely men. The way that somebody gets into medical respite, people come from the hospital, but they also come from the street or the shelter. In the hospital, our hope is that every single case manager in the hospital knows about medical respite and knows when they are discharging somebody experiencing homelessness that they think about medical respite. Unfortunately, too many times I've seen people who get discharged to the street, either because case managers didn't know that medical respite was something that existed, or more often because the patient in the hospital, was not identified as experiencing homelessness. So that's just taking a step back and really impressing the importance of screening at every single visit when somebody comes to the emergency department, to ask a validated screening question about housing instability or homelessness, so that we can really get honest answers and figure out who is experiencing homelessness in that moment. And the reason why I say every single visit is because homelessness is not a fixed status. People experience homelessness, and some people go in and out of homelessness multiple times in 1 year. Some people experience homelessness chronically over a period of time. So it's really important at every single visit to not make any assumptions and to ask about housing status. I would love for hospitals to more consistently be asking about housing status using a validated screening tool. Right now, we really rely on sort of a hodgepodge of data, including if somebody happens to enter the ICD-10 code, the Z59 code for homelessness or housing instability. If somebody uses an address that happens to be a homeless shelter. The problem is that many people experiencing homelessness will give an address that might be a friend where they get their mail. It might be that they use a church where they go to breakfast. But unless you as a community know every single address of every single place where somebody gets services, then you will miss that person is experiencing homelessness unless you ask directly. And no, you should not ask, are you homeless? Because first of all, you're not going to ask anybody except somebody who seems homeless, right? And that's just not the question that you want to ask, right? It's an insensitive question. It's a question that somebody would be embarrassed to answer, but to kind of ask in a very open-ended, non-judgmental sort of a way, what's your current housing situation? Because it's only if we understand the social determinants of your life that we can best care for you, right? You can't implement a plan that we put together in the hospital if you're living on the sidewalk, right? If the medications that we're prescribing require refrigeration. And so it's really just about, we need to know about your life circumstances so that we can adequately care for you and come up with a treatment plan. So that's from the hospital side of things. From the street and the shelter side of things, we have case managers all across the city, shelter providers all across the city who are seeing people experiencing homelessness who are quite medically vulnerable. And Unity Healthcare, because we've been doing this work since 1985, we have great relationships. We're in all the low barrier shelters. We're doing street outreach with outreach workers and housing case managers. We're in day centers and meal programs. So people can reach out to us when they're concerned about somebody, and we can either go see them in the moment if it's really sort of an urgent situation, or we can see them during our clinic hours when the case manager brings them to our attention. And so it's really important to have that partnership between the medical providers doing the medical respite and the community partners who are meeting the needs of people experiencing homelessness more generally.